Hello, my name is Ireland, and my show off number 8 is on cerebral palsy and the different types. So first we gotta understand like the meaning of cerebral palsy. So cerebral is brain and palsy is like your problems with your muscles. This is a neurological condition and it's caused by injury to the immature brain. So it's gonna mainly be around the kids. It is non-progressive, so that means it's characterized by non-progressive disturbance of the motor system, and it's non-progressive, and so that means the damage is done and doesn't continue. So that's kind of good, but it's also not good because it's damage. Um, and the child needs treatment to help with these effects because if they don't get treatment, the effects can be harmful, like throughout the rest of their life. So they need to have treatment to fix and help them be able to um, properly go through the rest of their life. For the onset is mainly for kids, like I said before. The damage ranges between kids too. It can be more severe or less severe. One out of two, or 1 to 2 out of 1,000 school children are diagnosed with cerebral palsy, and they can have any type of dysarthria. Um, and the onset is the early childhood, either 1 or 2 years old. Um, One of my friends in high school, I believe, had this, and we didn't even know that he had cerebral palsy until he had to tell us. And so he had gotten treatment and everything, and so he was completely fine. You could kind of tell in his hands they were a little stiff, but I mean, he played football and everything, so um, it is like they can go on living a normal life depending on the severity. Okay, so what's damaged? So this kind of depends on what area it is to tell what type of disorder it is. And so some clinical motor disorders, you can have spasticity, and this is about 70 to 80% of children with CP, and it's damage to the pyramidal system, which is this one just directly in the middle with the lateral cortical spinal tract and the anterior cortical spinal tract. And then dyskinesia is most common is athetosis, and it's 10 to 20%. And it's the extrapyramidal system, which is this one that we talked about with the rubiospinal and um, just those systems. That's just one example there. Um, and then ataxia is 5 to 10%, and its cerebellar system is damaged. And so that's this one on the very top. You can kind of see that connection there is important. So it'll, of course, cause problems if it is ruined. Kind of an explanation is the kids with cerebral palsy. They could have dysarthria, but not all dysarthric kids have cerebral palsy. So, kids with cerebral palsy, dysarthria, but not all dysarthric kids have cerebral palsy. And then for adults, since cerebral palsy is mainly a kid disorder, for adults, it's flaccid dysarthria, and it's mainly muscle dystrophy. So, there's that. And then some common causes of cerebral palsy are prematurity. This is when a preemie baby will tend to have neurological delays and is delayed developmentally, um, and that could be a cause. Anoxia, that can happen whenever maybe the umbilical cord is around the child's neck during birth or pregnancy, or if during pregnancy they have complications, like they're stuck in the um, pathway and cannot get any air. Anoxia is like without oxygen. So that really damages the brain for a little precious baby. Kernicterus, not sure how to say that, but it's what happens whenever there's high levels of bilirubin in the baby's blood. And there's kind of a little picture of it right here. When that happens, it kind of poisons the baby and it gives the baby jaundice, which is really sad. And it kind of taints the blood, um, and so that's just not a good thing to have, um, and that could also cause CP. They can also have birth trauma, trauma to the brain, and then also the infant or mother could get an infection. An example would be meningitis, infection of the brain, and that can also lead to cerebral palsy. Topological classifications, these are just kind of the different types you can have. Um, of course, like the picture kind of explains it a little bit. You have unilateral and bilateral. And then, of course, the quadriplegic is total body paralyzation. And those are just the different types. Of course, you can kind of see like the first of it, mono is one, hemi is um, like one side. Um, Dip is going to be two, tri is three, quad is four. You can kind of remember it that way. So cerebral palsy in speech, um, children can have developmental dysarthria, and it's actually present in 75 to 80% of children with cerebral palsy, just because their muscles aren't working like they're supposed to. So of course it's going to hurt their speech muscles, and then therefore hurting their speech. Kids with or they will have speech and swallowing issues. And those also can range in severity, but like I said, if you have a problem with your speech muscles, you probably have a problem with every thing that goes along with that. So, of course, they have to have treatment with speech and swallowing, which is very important. All right, that's all I have. Thank you all so much for listening. Hope you all have a great day.